So an annual gynecological exam is an opportunity for you to meet with your gynecologist and check in on how you're doing. The first thing will be getting a measurement of your vital signs, so getting your height and weight and blood pressure and your heart rate. And then secondly, you'll meet with the doctor and they'll ask you a lot of questions about your history and how you're feeling when you come into the office that day. It's important to have an annual gynecologic exam so that you can touch base with your gynecologist. There are a lot of things that you can touch base about, including, how your periods are, what your reproductive planning needs are. If you're due for any screenings like a pap smear or a mammogram, that's a good time to talk about it as well. You can start with gynecologic exams in the teen years is probably a good time. As soon as you start having a period and if you have any issues, you can see a gynecologist right away. We also recommend touching base with the primary care doctor, who could be your OBGYN, to talk about immunizations, including the HPV vaccine. That can be administered as early as age 9. You can see any one of our care team members for your gynecologic exam. That includes physicians, that includes midwives, and nurse practitioners. It doesn't have to be during any specific part of the year. You can touch base with your gynecologist or your care team anytime throughout the year, whenever you are available, or if you have anything in particular that you want to talk about. Annual exams are an opportunity to intervene and touch base with your doctor. Part of the screenings are to evaluate if you're at a higher risk for a certain type of cancer, if you should be doing a different kind of screening or doing screening more frequently. They're also an opportunity to help catch problems before they become big problems. So if you have heavy periods, that's a good time to talk to your doctor about what you can do for it before it becomes a big problem for you. Keeping up to date on your pap smears is really important because we know that early detection and intervention in terms of addressing cervical dysplasia or abnormal changes on the cervix, like an abnormal pap smear, if you intervene earlier, then that can lead to better outcomes for you. It's a good idea to touch base with gynecology if there are any issues with the onset of periods. Sometimes when people start having periods, they can be irregular or heavy, and so that's a good time to talk to your gynecologist or your care team about how to address that and make you feel better. It's also a good idea to keep up to date on your immunizations, like the HPV vaccine. That can help prevent HPV infection and cervical cancer down the road. The annual exam in early adulthood can be really important to touch base about reproductive planning, contraception planning, STI screening if you're sexually active, and making sure that you're up to date on your pap smears. It can also be a really great opportunity to have your doctor talk to you about other health maintenance things that would be important to address, like they'll check your weight and your BMI and see if there is any kind of intervention that needs to be done there. They'll also screen you for lifestyle habits like smoking and talk to you about healthy habits that you can implement early in your life to make sure that you're as healthy as you can be going forward. In later adulthood, the annual exam can be a great time to talk to your care provider about, entering menopause and the life changes and body changes that accompany that. It's also a great opportunity to keep up to date on your pap smear and mammogram.